Good day from Alivio Physical Therapy. My name is Dr. Anthony Hillebrand, and today we will be talking about one of the other comments/questions I get quite often, which is how quickly will I get better? So, this is a complex question. Lots of factors go into how quickly you get better. Depends how bad you are to begin with. If it's just a minor sprained ankle, it might be pretty quick. If it's a fourth surgery on your low back, it might take a little bit of time. Or if you've had this issue for 12 years off and on, it might take a little bit more time to get you better. I will occasionally have patients come in and they will say, well, I could go to this healer or this type of person and they could fix me in one visit because my third cousin's brother's aunt went there and was fixed in one visit. Could they? Maybe. But on average, my patients are somewhere in the 6 to 12 visit range. Probably averaging closer to 8 visits to get better. If another one of those factors that plays a huge role, they do their homework. Since I don't give long lengthy exercise programs, I give exercise programs meant to be done in 10 minutes. I expect people to do their exercises because at the end of the day, if you look at all of the research, exercise is one of the biggest factors in whether or not people feel good, feel better, get better. So with the exercises that I give them, they'll be similar to the ones that they do in the clinic with the goal of repetition. So you can do them in your sleep without thinking about them. We do give out paper handouts that also have the ability to go online, and we watch videos on how to do the exercises. So losing it, the exercises are simple enough. You really should be able to remember them. So if people have a long injury history, multiple medical issues, like you're diabetic. If you're diabetic, it's going to take longer, unless you're very well controlled, and that's just the nature of diabetes. If you have heart failure, high blood pressure, you're significantly overweight, all of these things play a factor in how quickly you get better. But my goal here is still to get you better as quickly as possible, and we'll have that honest conversation. But outside of when I treat some forms of dizziness that I can fix in 2 or 3 visits, most things we have to undo people's habits they've developed while they've been injured. You sprain the outside of your ankle, it hurts, so you start walking on the inside, and come the next week, your inside of your ankle hurts now. So it's a more complex problem because now we've got to treat both sides of the ankle versus just one, which is why I urge people to get into therapy sooner rather than later, because the longer you wait, the more issues you're likely to develop over time. So that being said, we look at, how old the injury is, how much pain you have, whether or not pain limits what you do. Because I have some patients, it doesn't matter if it hurts, 9 out of 10, 10 out of 10, they're going to do whatever I ask them to do and participate in everything fully. And then I have other patients who it's probably about a 2 and they weren't willing to do anything because they have pain. Doesn't matter how little, how big, they have pain, so they don't want to do anything. So once we can get through that, then we look at how good they are about doing their homework. And yes, I give everybody homework. If they do all of that, most of the time we can get things turned around pretty quickly. Because my goal is really to get you better as quickly as possible so that, if insurance is a limiting factor, if finances are a limiting factor, you still get the care you need at an effective cost to you. So, and if you have additional issues in the future, you're more likely to come back, because if you go somewhere and they see you, 25 times, you're really not all that much better. Not likely to come back and see them. If you come to a place and you get better in, 8-10 visits, and you're significantly better, you're more likely to come back, and more importantly, you're going to tell everybody else to come see me here. Which is why we have such a diverse level of treatment here. So, because we treat everything from lymphedema to chronic pain to back pain, knee pain, ankle pain, if it's a pain, we probably treat it. As well as balance disorders, concussion, including our virtual reality-based concussion system, dizziness issues. We treat all of this here, and our goal is to get you better quickly. Because having been a patient as a child growing up multiple times in and out of the hospital, I know the importance of trying to get things better sooner. So, if you have additional questions, you can throw a comment below, subscribe to our channel, because I'll be posting these regularly. Check us out on Facebook at Alivio PT. And then our website is aliviophysicaltherapy.com. Thank you.